Angelique Lewis wrote to us at the website namesofthedead.com and wrote to us about Bernadine Oakley, age 60, of Des Moines, Iowa. She died of an aneurysm. She once had breast cancer and ovarian cancer. She got so concerned with the cost of it that she was fearful for the return of the cancer. She couldn't afford medicine for her high blood pressure, and it finally caught up with her. My mother's funeral was a standing room only event. She had for over 20 years instructed a preschool class and assisted many within our community. Her light left this earth too soon. Now let's hear from Barbara Brown, writing to us about Pat DiPolito of Medford, Massachusetts. My brother was diagnosed with colon cancer at the age of 57. He was self-employed and he didn't have health insurance. Surgery was recommended, and at one point he was asked directly by the surgeon, "How do you plan on paying for this surgery?" Of course, he couldn't pay for it himself. As a result, he died 6 months later. Now let's hear from Leslie Walsh, writing about William Walsh, age 62, of San Diego, California. My ex-husband died of bladder cancer because he lived in fear of running up preventable medical expenses due to lack of insurance coverage. His cancer was far advanced by the time he was forced to seek help from the City of Hope. With simple well-person exams, his cancer could have been discovered much earlier on and could have been treated. And he would be alive and living with me, my husband, today. Now let's hear from Winifred Hahn concerning Declan Hahn, 56 years old, right here in Washington, D.C. My father died of throat cancer on March 7th, 1994. He had been suffering from a sore throat for nearly a year. But being a freelance photojournalist and a small business owner, he could not afford to go to the doctor. By the time he went to the doctor, the pain had become so bad that he couldn't eat. He couldn't eat. He had stage 4 terminal throat cancer. He was treated at the NIH in Washington, but there was very little they could do to even try to save him. If he had gone to the doctor sooner, there's a good chance he might still be with us today. Let's hear from Tracy Sykes about Terry Lynn Sykes of Wilmington, North Carolina, who wrote to us at this website, namesofthedead.com. She wrote as follows: My sister could only afford to keep her diabetic son insured, not herself. She had to choose between her son and herself. Her cancer was not diagnosed until it was stage 4. She died after fighting it for 2.5 years. Her son is alive today. He's 10 years old. He lost his mother. Let's hear now from Sam Downey about Megan Ratzow of Portland, Oregon. Megan didn't have health insurance, so she didn't go to a doctor until it was too late. She finally went to the emergency room, and she died in the hospital a week later. None of us really knew she was even sick. If she'd had health care, she would have been able to get the treatment she needed before her cancer was so far along that it couldn't be treated. Megan was a very good person. The world could have used her spirit for a few more years. Now let's hear from Alicia Black concerning Michelle Dennis of Westchester, Pennsylvania. Michelle Dennis, nicknamed Mickey, was not my relative, but she was the sister of my best friend and the love of my life, Tony Dennis. She died because she did not have health care. By the time she was diagnosed with ovarian cancer, she was terminal. She was diagnosed in May 2001 and died that August. Not only did I lose Mickey, but I also lost Tony, who in his grief committed suicide the day after Mickey passed away. I lost 2 friends because there was no health care for Mickey to receive timely diagnosis and treatment. Now let's hear from Elaine Hill, who wrote to us at the website namesofthedead.com, this website, concerning Donald Ray Yost. My brother endured months of pain, putting off going to the doctor because of concerns with how much it would cost. When the pain became so severe that it was intolerable, he made a doctor's appointment. After x-rays were taken and tests were run, the doctor delivered a grim diagnosis: cancer spread through his whole body and bones. My brother refused treatment because he knew the cost would drain his family of any savings and they would lose their home. To prevent his wife and 2 daughters from having their financial security and their home taken away, my brother chose not to undergo the medical treatment he would need to give him a fighting chance to live. He said he would not bankrupt his family in order to undergo the expensive long-term treatment. He died less than 6 months later on May 6, 2007. Now let's hear from Jessica Falker of Vermont, who wrote to us about her Aunt Anita. My aunt had no health insurance and couldn't afford the test to find out what was wrong with her. By the time she finally could afford to get tested, she had stage 4 cancer. She died only 3 months later. I'm sure Jessica misses her aunt. Let's hear now from Robert Burns about Jay Holman of Goldsboro, Maine. Jay never saw a doctor because he had no health insurance. For 3 years, he lived with health issues until he became seriously ill. It turned out to be cancer, and it spread through his body. He had stage 4 cancer when he was hospitalized, and 6 weeks later, he passed away. A sad ending. Yes, a very sad ending. For a business owner, an Eagle Scout, a merchant Marine, and a fine human being. Let's hear now from Jennifer Lawrence, who wrote to us about Guy Lawrence in Dubuque, Iowa, and wrote to us at this website, namesofthedead.com. My father worked 4 jobs a day to keep my family fed and housed and clothed. None of them provided him with insurance. One day he caught a cold. 2 days later it turned into pneumonia. He didn't go to the hospital because he didn't have the money to pay for a visit to the emergency room. He was sure it would go away. Instead, it killed my father. Let's hear now from Eric Norton concerning Neil Norton of Joseph City, Arizona. My father had his first heart attack on his 46th birthday, and he survived. He was afraid to go to the hospital because of the cost and the humiliation of being uninsured. After the emergency had passed, he couldn't go to the doctor because he didn't have enough money to pay up front. 2 days after his birthday, he had another heart attack, and this time he died in the back of an ambulance, still not sure whether he should even be trying to seek medical care because of what it would cost. My mother became uninsured recently after her job fired her because she needed surgery. She's 56 years old. She's $17,000 in debt from her surgery and hoping like hell not to get sick again. She's now an uninsured nurse, no less. I'm scared of history repeating itself. I hope I don't have to come back to this webpage